Assalamualaikum and hi to everyone. Thank you for having me. My name is Mohd Ismail bin Abdullah. I am student 30 in Diploma Graphic Design and Creative Media, and I am going to speaking to you today about patients who have contracted Covid-19 virus. Did you know what is coronavirus? Okay, let me explain. Coronavirus are a family of viruses that can cause respiratory illness in humans. They get their name corona from the many crown-like spikes on the surface of the virus. Severe acute respiratory syndrome (SARS), Middle East Respiratory Syndrome (MERS), and the common cold are examples of coronavirus that cause illness in humans. The new strain of coronavirus, Covid-19, was first reported in Wuhan, China, in December 2019. The virus has since spread to all continents except Antarctica. You all must want to know, where do coronavirus come from? Coronavirus are often found in bat, cat, and camel. The virus live in but do not affect the animal. Sometimes this virus then spread to different animal species. The virus may change, mutate as they transfer to other species. Eventually, the virus can jump from animal species and begin to infect human. Back to our main title. If one of your family member is affected with COVID-19, how do you feel? You must be sad, right? That's how I feel now. My cousin has been infected with that dangerous virus. Let me show you the video that Malaysian Ministry of Health staff came to pick up my cousin to be taken to a quarantine center in Negeri Sembilan. For your information, my cousin is no longer recovering from COVID virus and still positive. First of all, a virus infects the patient by entering healthy cell. There, the invader makes copy of itself and multiply through to your body. The new coronavirus latches its spiky surface protein to receptor on healthy cell, especially those in your lung. Specifically, the viral protein boosts into cell through ACE2 receptor. Once inside, the coronavirus hijack healthy cell and take command. Eventually, it kills some of the healthy cell. Next, COVID-19. The illness caused by the coronavirus starts with droplets from an infected patient cough, sneeze, or breathe. They could be in the air or on a surface that patient touch before touching their eyes, nose, or mouth. That give the virus a passage to the mucus membrane in patient throat. Within 2 to 40 days, the patient immune system may respond with symptoms including fever, a cough, shortness of breath or trouble breathing, fatigue, chill, sometimes with shaking, body aches, headache, sore throat, congestion or runny nose, loss of taste, loss of smell, nausea or vomiting, and diarrhea. The virus moves down to the patient respiratory tract. That's the airway that include the patient mouth, nose, throat, and lung. The patient lower airway have more ACE2 receptor than the rest of your respiratory tract. So, COVID-19 is more likely to go deeper than virus like the common cold. The patient lung might become inflamed, making it tough for the patient to breathe. They can lead to pneumonia, an infection of the tiny air sac called alveoli inside the patient lung, where patient blood exchange oxygen and carbon dioxide. After that, the doctor will do a CT scan of the patient chest, and they probably see shadow or patchy areas called ground glass opacity. The symptom end with a cough and a fever. About 5 to 8 days after symptoms begin, they have shortness of breath, known as dyspnea. Acute respiratory distress syndrome (ARDS) begin a few days later. ARDS can cause rapid breathing, a fast heart rate, dizziness, and sweating. It damages the tissue and blood vessel in your alveoli, causing the breath to collect inside there. This makes it harder or even impossible for the patient to breathe. Many patients who get ARDS need help breathing from a machine called a ventilator. As fluid collect in the patient lung, they carry less oxygen to the patient blood. That means the patient blood may not supply the organ with enough oxygen to survive. This can cause the kidney, lung, and liver to shut down and stop working. Not all patients has this serious complication, and not everyone needs medical care. But if the symptoms include trouble breathing, the patient must get help right away. From the three of my main points, we can see COVID-19 virus very dangerous to all, no matter old or young. So, for the conclusion, we must stay safe by taking some simple precautions such as physical distancing, wearing a mask, especially when distancing cannot be maintained, keeping room well ventilated, avoiding crowd and close contact, regularly cleaning your hand, coughing into a band, elbow or tissue, and the last one is always sanitize your hand. I hope with doing that, we can prevent COVID-19 virus from continuing to infect. That's all. Thank you from me.